And welcome back. If you're having spinal pain or spinal issues, then you want to talk with our next guest, Dr. Gerardo Zavala. He's a board-certified neurosurgeon. And also Dr. Ladislao Albert. He's also a board-certified neurosurgeon. How are y'all doing today, Doctor?
Good, sir. How are you?
Doctor, how are you doing?
Nice to see you.
Well, thanks for coming on. Now, this is a very serious issue that we're talking about, spinal pain, spinal issues. What is the most, Dr. Zavala, what's the most common complaint that you see or symptom?
Yeah, you know, I think a lot of patients who come see us think that they're going to see a neurosurgeon and that means surgery. And actually, it doesn't. Most of the stuff we see is musculoskeletal. We have a broad range of therapies we can provide there, including injections from two pain doctors. And we really try and branch out and educate the patient that what they feel is usually common, very temporary, and very self-limiting. And if they do need surgery, you get that opinion from several board-certified neurosurgeons. We have 3 in our practice.
So you're well qualified.
Yes, sir.
But just because you come in doesn't mean that surgery is on the horizon.
No, not at all. Most of the people who come see us don't even need surgery. And so I really want to kind of get that out to the community, that it's just a visit, like a visit to your general practitioner to see why you're having this back and neck pain.
Yeah, and Dr. Albert, if you've got some kind of pain, you don't want to ignore it, right? And why should folks go to NSC?
Definitely, it's important not to ignore it. You know, like Dr. Zavala said, the vast majority is something very simple, like a muscle strain or an irritated tendon or something of that nature. But in some cases, it can be something more severe that, if you ignore it, in time can not only get worse, but even cause weakness or numbness or difficulty with functionality. So you definitely shouldn't ignore it.
So don't ignore. And then Dr. Zavala, why should folks think of NSC first?
You know, I think that we provide something very unique in San Antonio. We're the only freestanding building that gives you evaluation of your nerves, gets you pain relief. We have everything from digital x-rays to providers that are very well qualified, not just for spine stuff, but also brain tumors we do. We have EMGs, which is our test for nerves, and we have PAs who help us, physician extenders who really help and understand the patient who comes in.
Ah, great. So you cover, what all do you cover, Doctor?
Anything touching the nerves. So a lot of people think that carpal tunnels are not us. Actually, that is us. We do necks, backs, brains. We do aneurysms, vascular, carotid stuff. We cover a lot of areas.
So just a wide array then?
Yes, sir.
Also, what can patients do that to prevent spine problems from occurring?
It's an excellent question. I think the biggest issue in terms of why spine problems happens, outside of aging, which we have unfortunately no control over, is excess weight, diabetes, smoking. These are all factors that really help wear down the spine a lot more quickly than they normally would. So having good core strength, abdominal and gluteal strength, at the same time maintaining a healthy weight, controlling diabetic sugar control, and then really avoiding smoking all really helps prevent spine problems.
So smoking and some of those things, diabetes, that can affect all, I guess, the whole,
definitely.
whole system, huh?
One of the most important components of your spine are the discs. You always hear people talking about a blown disc or a herniated disc. That disc tissue is created and unfortunately never reforms. So as it wears down, unfortunately, it gets worse and worse, and it can cause problems. Avoiding all of these other factors really helps reduce the speed of it wearing down.
Oh, wow, okay. So there's a lot of folks I know that have like almost no disc left at all. Can you help? Is there help for that?
Oh, definitely. And again, it doesn't always mean surgery. There are ways with good therapy, good body mechanics, and some pain treatments that can actually help provide good benefit without needing surgery. Now, if it does come to surgery, we are very much specialized in the very small incision, minimally invasive outpatient surgery, so they really can get back into life much more quickly. Well,
I know somebody needs to come see you guys then, and you probably know somebody as well. So it's the Neurosurgery and Spine Consultants. They're over on Centerview. Matter of fact, they've got 4 different locations here in San Antonio. So give them a call, 210-255-8935. You can always visit online, neuroandspineconsultants.com. And again, their phone number is 210-255-8935. All right, well, thanks. Really appreciate it.
Thank you very much again.
Had some great information. I'm sure there's a lot of folks out there that could use your help.
Yes, sir.
All right,
Thank you.
Thank you, doctors.